Students, starting with the next part of this compiled MCQs. Now the question is elimination rate constant of a drug is 0.05 per hour. So what is the half-life? Now the formula for half-life. Half-life is equal to 0.693 upon K. That is the elimination rate constant. So in this case, it is very simple, 0.693 upon 0.05. So when you calculate, it will come out to be 13.9. So that is the formula for, that is the answer for this question. Anionic and slightly acidic drugs, they usually bind to. So acidic drugs, they always bind to the albumin, and basic drugs, they bind to alpha-1 acid glycoprotein. So this is a very simple question and you can always answer this. The following table gives the data under the curve of drug A alone and AUC of drug A when combined with drug B. Okay, now following data. So A alone, area under the curve. So drug A का आता है 550 and drug A plus B का आता है 1850. The p-value is 0.01, less than 0.01. Which of the following statement regarding these drugs is most correct? Now, what are the sentences, what are the statements given? Drug B decreases the first pass metabolism of drug A. Drug B increases the systemic metabolism of drug A. Drug B decreases the intestinal absorption of drug A. And drug B increases the renal clearance of drug A. Now, as we know that area under the curve is basically extent of absorption, right? The area under the curve explains extent of absorption. And extent of absorption means how much drug is available. So, bioavailability of the drug. Now, as we can see, when the drug A was given alone, the area under the curve was 550. Now, when you combined B, the area increased to 1850. That means the drug B increased the bioavailability of drug A. So, that means now drug B decreased the first pass metabolism of drug A. That is very likely that drug B decreased the first pass metabolism and increased the bioavailability. Drug B increased the systemic metabolism? No. So, the correct answer here is this. The next question that we have to discuss is category A, B, C, D, X division of drugs is based on. So this category of A, B, C, D, X is based on safety in pregnancy, dose adjustment in renal failure, therapeutic index and safety, or over the counter. Now this category, the various categories are basically indicative of safety in pregnancy. Category A क्या होती है? That means the drug is safe. There is no risk, right? Category B, there are no risk, no adequate studies, right? Category C, that adverse effects seen in animal studies. Potential benefits may warrant the use. May warrant the use in pregnancy. Category D is that there is positive evidence of fetal risk, right? But again, potential benefit may warrant the use in pregnancy. Category X, they have shown fetal abnormalities and so not to be used even if there is potential benefit. So category X drugs not to be used. These are drugs like thalidomide, methotrexate, right? In this we have drugs like losartan. In this we have drugs like gabapentin. Moderately we have metformin, and here we have all the safe drugs. Next question. What dose of dopamine acts preferably on beta receptors? Which dose of dopamine? Now dopamine की कौन सी dose acts preferably on beta 1 receptors? So the dose which acts preferably on beta 1 receptors less than 2, 2 to 10, 10 to 20, more than 20. So the answer is less than 2. Less than 2 पे it results by acting on beta 1 receptor and there is renal vasodilatation, right? If you see 2 to 10, then 2 to 10 में तो ये basically, sorry, at less than 2 it is this, at 2 to 10 it causes cardiac stimulation, and more than 10 it causes alpha 1 stimulation, right? So the beta 1 receptors are acted upon at 2 to 10. Less than 2 it causes renal vasodilatation. A patient is diagnosed with cluster headache. Now treatment of choice is, so what is the treatment of choice in cluster headache? Cluster headache में do we give oxygen, do we give 6 liter of oxygen, do we give subcutaneous sumatriptan, or do we give sumatriptan? So here the correct answer will be sumatriptan. Now why? Cluster headache is basically a type of trigeminal pain, right? Now इसमें usually subcutaneous or intranasal sumatriptan or inhalation of oxygen is effective. Zolmitriptan is also effective. Dihydroergotamine you also can give them. Various prophylactic agents can be given like lithium, verapamil and all. So now oral medications. The question is, a patient is diagnosed with cluster headache, treatment of choice is, will you give 8 liter of oxygen, 6 liter of oxygen, subcutaneous sumatriptan? Here you will give subcutaneous sumatriptan. It is a kind of trigeminal pain. Oral medications are found to be less satisfactory, and it is seen that if you give subcutaneous sumatriptan or inhalation of 100% oxygen, that is 12 to 15 liters per minute for 15 minutes. So this subcutaneous sumatriptan is 6 milligram. They are found to be effective. Another way is also inhalational, that is intranasal. 20 milligram sumatriptan can be given, intranasal 20 milligram sumatriptan can be given by nasal spray. So that is also found to be very effective. So this is the answer in this case. Coming to the next question, a patient presents with grade 2 pulmonary artery hypertension. Vasoreactive stimulation test is negative. Which is the most preferred initial management? What are the options given? Epoprostenol, which is a prostaglandin analog, prostacyclin analog, amlodipine, which is a CCB, now alprostadil, which is again a prostaglandin analog, and ambrisentan, which is an endothelin receptor antagonist. Now endothelin receptor antagonist, they are indicated when vasoreactive stimulation test is negative. As you can see, all these drugs are used in pulmonary arterial hypertension, but if vasoreactive stimulation test is negative, then this is the drug of choice, that is bosentan, ambrisentan, macitentan. Let's see the drugs which are used. The first category drug is nitric oxide pathway, and in that we have phosphodiesterase 5 inhibitors, that is sildenafil. Then second is endothelin receptor antagonist, in which we have bosentan and ambrisentan and macitentan. Then third we have prostacyclin pathway, in which we have epoprostenol, then treprostinil, iloprost, and selexipag, which is prostacyclin receptor analog. Then we have CCBs also. So when vasoreactive test is negative, we use ambrisentan. Next, resistant hypertension is defined as inability to attain goal blood pressure in spite of concurrent use of 3 antihypertensive agents of different classes prescribed at optimal doses, which includes. So what is resistant hypertension? So resistant hypertension means failure to control blood pressure in a 3-drug regimen. Right, now what are those 3 drugs? They are usually ACE inhibitors or ARBs, CCBs, and diuretics. So what are the drugs which are given here? Alpha blockers, reserpine, diuretics, and alpha methyl dopa. So out of that, this is the correct answer. Then drug of choice in resistant hypertension is aldosterone antagonist. So this you remember, okay, like spironolactone. Next, a 65-year-old man comes to OPD with history of fall. He is hypertensive with history of atrial fibrillation, okay, presently on captopril, atenolol, aspirin, amiodarone. He presents with the following finding as shown in the image. What is the most probable diagnosis? Now, I know the image is not very clear here, but since the patient is AF, fall करके आया था, captopril, atenolol, aspirin, amiodarone, and he is having some skin lesions here. So what is it? What are the options? Silver toxicity, lupus pernio, amiodarone-induced skin lesion, and captopril toxicity. So this is basically a case of amiodarone-induced skin lesion, and it is called as blue man syndrome. I know the picture is not very clear, but so this basically, because why it occurs, it is because deposition of lysosomal membrane bound dense bodies similar to lipofuscin, okay, in dermis of patients who are on amiodarone therapy. So this is amiodarone-induced skin lesion. These type of questions can be very commonly asked in dermat section, and dermat section में पूछा जाएगा और आपको लगेगा dermatology का क्वेश्चन है, लेकिन यह है किसका? Pharmacology का. So इसीलिए it is very important कि even radiology, anesthesia, dermatology, इनके जो questions आते हैं ना pharmacology के, वो आपके पूरे पक्के होने चाहिए. Next question, a patient of chronic liver cirrhosis presents with ascites. Which of the following is the best diuretic to be used in this case? Now a patient is this is chronic liver cirrhosis, ascites. Which is the best diuretic? The best diuretic. Now what are the options? Eplerenone, chlorothiazide, furosemide, and triamterene. Now due to ascites, here the game changer is ascites. Due to ascites have patient who, so there is a decrease in extracellular fluid. So it activates the renin-angiotensin pathway. Like it results in increased level of aldosterone. Okay? So here we will use aldosterone antagonist. We will use aldosterone antagonist like spironolactone or eplerenone. So this is the drug which is used in this case. So it will reduce the aldosterone. Next, what is the prenatal dose of dexamethasone given for lung maturation in premature infants? Options are 6 mg 2 doses 12 hours apart, 12 mg 2 doses 24 hours apart, 6 mg 4 doses 12 hours apart, and 6 mg 4 doses 24 hours apart. So dexamethasone is a long-acting corticosteroid. Now So dexa and betamethasone, they are used antenatally for, why we want to use them? For fetal lung maturity. Surfactant नहीं होता है बच्चों में, अगर premature delivery हो रही है तो we need to give steroids. Both the drugs are given by intramuscular route to the mother. Okay, total dose जो हमको देनी है वो देनी है 24 मिलीग्राम. Now इसमें difference क्या है? Betamethasone is given 12 milligram, 2 doses, 24 hours apart, right? And dexamethasone is given 4 doses, 6 milligram, 12 hours apart. So this is the difference. You need to remember this. And so the correct answer here will be dexamethasone is given 6 milligram, 4 doses, 12 hours apart. So this is the correct answer. Next question. A 60-year-old female patient presents to the hospital for routine checkup. Okay, she attained menopause at 52 years, has a past history of Colles fracture. So this is like a postmenopausal osteoporosis. DEXA scan was done and T score is 2.5. What should be the treatment given to this patient? So this is a case of postmenopausal osteoporosis, right? Now in this, the T score is 2.5. What should you give? Vitamin D and calcium, alendronate, repeat DEXA, hormone replacement therapy. The option is very clear here that you have to give alendronate. And what is alendronate? Alendronate is a bisphosphonate. They act by inhibiting the action of what? Osteoclast. They inhibit the action of osteoclast. So this is the answer. Adverse effect यहाँ पे alendronate का क्या होता है? It causes esophageal toxicity. So that is something which one has to keep in mind. Next question, dose of carbetocin for postpartum hemorrhage. Now carbetocin is what? Carbetocin is basically a long-acting analog of oxytocin, right? It is a long-acting analog. Now what is the dose for PPH? It is used in PPH and it is prevention of uterine atony. Uterine atony अगर हो जाती है after cesarean section, so वहाँ पे भी it is used. Now this is a very factual question. You need to remember this. If you don't know, then don't attempt this question. Don't do any guesswork. The right answer here is 100 microgram intravenously over a period of 1 minute. So that is the right answer. The next question, which of the following drug is the only medication useful in preventing disability progression in patient with primary progressive multiple sclerosis? The options they have given are natalizumab, siponimod, ocrelizumab and rituximab. Again a very factual question. So the right answer here is ocrelizumab. Ocrelizumab is the only drug effective in preventing disability progression, right, in patients with multiple sclerosis. इसके अलावा other drugs that are given are interferon, then glatiramer, then dimethyl fumarate. These are also very commonly used, but they are used in the initial therapy to reduce attacks. ठीक है? Then for patients with active secondary disease, you use what? The drugs which are used are cladirabine, ocrelizumab, siponimod and ofatumumab. These are the drugs used in secondary active disease. The most effective cessation agent when used as monotherapy for smoking cessation. Now, most effective cessation agent when used as monotherapy: varenicline, nicotine gum, sustained release bupropion and nicotine patch. Now, the most effective drug. Please remember the question. Most effective. ऐसे most likely, unlikely, effective, not effective, इन चीज़ों पे ध्यान देना है. So most effective cessation agent is varenicline, right? So what is varenicline? Varenicline is actually a partial agonist at alpha-4 beta-2 nicotinic receptors. इसके side effects होते हैं that are thought disorders, so psychiatric side effects are there. The nicotine gum. Nicotine is basically used as a gum, as a patch, as a lozenges also, and they are also very effective. Dose is slowly decreased and finally they are withdrawn. Sustained release bupropion. Bupropion is an antidepressant drug and it is used for 8 to 10 weeks. Can result in seizures, CNS stimulation. The main effect of bupropion is to inhibit the reuptake of 5-HT, that is serotonin, norepinephrine and dopamine. Clonidine is found to be very effective in reducing the withdrawal effects of nicotinic. It is better than nicotine chewing gums and it can be used in patients with cardiac diseases also and can reduce craving and can reduce insomnia also. Next question, which of the following is an opioid antitussive agent? Okay, now opioid antitussive agent options that they have given is diphenoxylate, levorphenol, ambroxol and levopropoxyphene. अब इसमें diphenoxylate opioid है, levorphenol opioid है, levopropoxyphene opioid है, ambroxol ओपियोइड नहीं है. एम्ब्रोक्सोल इज एन एक्सपेक्टोरेंट, सॉरी एंटीटसिव नहीं है, इट इज एन एक्सपेक्टोरेंट. ठीक है, तो एम्ब्रोक्सोल तो हटा. अब ये सब ओपियोइड्स है, लेकिन ओपियोइड को पूछ रहे हैं एंटीटसिव कौन सा है. देखो क्वेश्चन की खासियत देखो, कंफ्यूजिंग करने वाली टेंडेंसी कि ओपियोइड एंटीटसिव. अब हम सोचेंगे यार ये सारे ही होते हैं, नहीं. ओपियोइड एंटीटसिव कौन सा है. अब देखो, लेवोरफेनॉल इज बेसिकली यूज्ड एज एन एनाल्जेसिक, इट इज नॉट यूज्ड एज एंटीटसिव. देन diphenoxylate is used in diarrhea because it causes constipation, so it is used in diarrhea. Now the levopropoxyphene is the only opioid which is used as antitussive. ठीक है, इसका जो डेक्सो आइसोमर होता है, डेक्स्ट्रो आइसोमर, दैट इज यूज्ड एज एनाल्जेसिक. सो दिस इज द ब्यूटी ऑफ दिस क्वेश्चन, दैट विच ऑफ द फॉलोइंग, सिंपल क्वेश्चन है देखने में पर कितना कंफ्यूजिंग है. विच ऑफ द फॉलोइंग इज अ नोवल एंटीडिप्रेसेंट ड्रग? विलाजोडोन, एसेनिपाइन, फ्लिबैंसरीन एंड ल्यूरासिडोन. नाउ आउट ऑफ दीज ड्रग्स, नाउ लेट्स सी व्हाट आर दे. विलाजोडोन is an atypical antidepressant, right? ये ठीक है, like it is like trazodone, ठीक है. एसेनिपाइन and ल्यूरासिडोन, these are antipsychotics है. And flibanserin is used in hypoactive sexual desire disorder in females. So this is flibanserin. So the answer that we write here is vilazodone, which is an atypical antidepressant and is a novel antidepressant. Next, which of the following antidepressant drug should be avoided in a patient of angle closure glaucoma? Angle closure glaucoma में कौन सी antidepressant drug should be avoided? This is the question. Now we have sertraline. This is an SSRI. Mirtazapine. These are all newer drugs. Venlafaxine SSRIs हैं. Amitriptyline. This is the only drug. This is a TCA. So TCA मतलब it is a tricyclic antidepressant and TCAs have got a very strong anticholinergic property, and anticholinergic property के कारण what it can do is it can precipitate an acute attack of glaucoma. क्योंकि anticholinergics हैं, ये लोग क्या करेंगे? They will cause mydriasis, and by causing mydriasis जो angle closure glaucoma है, that iris will basically then accumulate near the angle and will result in mydriasis. Sorry, will result in acute attack. So it has to be avoided in angle closure glaucoma. So the right answer here is amitriptyline. Which of the following anti-epileptic drug is used in treatment of neuropathic pain? Gabapentin, carbamazepine, pregabalin. All of them are used in the treatment of neuropathic pain. Gabapentin, pregabalin, they are first-line therapies, first-line treatment in neuropathic pain, right? They cause some sedation, dizziness, but they are very effective. Then SNRI, like duloxetine, venlafaxine, they are also used in neuropathic pain. Venlafaxine, it causes hypertension and ECG changes, so patients जिनमें cardiovascular risk है उसमें we cannot use it very conveniently. Then tricyclic antidepressants, they can be used in neuropathic pain. Carbamazepine का एक indication है, that is trigeminal neuralgia, so it is very commonly used in that also, right? So these are the various drugs which can be used in neuropathic pain. Which of the following drugs improves the bioavailability and prolongs the duration of action of saquinavir? Now, saquinavir is an anti-HIV drug, and it is a protease inhibitor. Now, options given are ritonavir, vitamin C, cimetidine, and remdesivir. Out of all these options, ritonavir is basically an inhibitor of CYP3A4 enzyme, and this saquinavir is metabolized by this enzyme. So ritonavir inhibits this enzyme, and thus it improves the bioavailability and prolongs the duration of saquinavir. This phenomenon is also known as ritonavir boosting. Okay. A patient on phenytoin for seizure disorder was prescribed sucralfate 4 times a day for peptic ulcer. Patient have phenytoin पे and is prescribed sucralfate for acidity. Now, what should be the minimum duration between consumption of two drugs? Now, minimum duration between consumption of both the drugs should be 120 minutes. Okay, 120 minutes means around 4 hours. So, why? Because sucralfate actually forms a viscous layer in the stomach, and this inhibits the absorption of other drugs. Right? Sucralfate viscous layer बनाता है, which inhibits the absorption of other drugs, which includes phenytoin, digoxin, cimetidine, ketoconazole, fluoroquinolones. So sucralfate therapy और इनके बीच में आपको कम से कम 4 hours का गैप रखना जरूरी है. Mechanism of action of remdesivir. Remdesivir was a drug. It was FDA approved drug used in COVID-19. Now it acts by inhibiting the RNA dependent RNA polymerase, right? So this is the action of remdesivir. RNA dependent RNA polymerase को inhibit करता है, and it is indicated in hospitalized patients. Hospitalized patients में दिया जाता है remdesivir with moderate to severe pneumonia. Next question: which of the following cephalosporins can increase the effect of warfarin, resulting in raised INR and increased risk of bleeding? Right. So this is cefoperazone, cefixime, ceftobiprole, and ceftazidime. Out of these drugs, cefoperazone is the drug which can cause hypoprothrombinemia and increase the risk of bleeding. Okay, so cefoperazone is the answer. A female patient presents with greenish vaginal discharge. Greenish vaginal discharge, pruritus. On colposcopy, strawberry cervix is noted. What is the drug of choice? Now, the condition is indicative of trichomonas vaginalis. Okay, so trichomoniasis या trichomoniasis बोलते हैं इसको. So this is the condition, and in this greenish discharge, pruritus and strawberry cervix is indicative of this infection. For this infection we use metronidazole or tinidazole. The right answer is this. What is the mechanism of action of cyclosporin? Now cyclosporin is basically an immunosuppressant, right? What are the options given here? Calcineurin inhibitor, mTOR inhibitor, interleukin-2 receptor antagonist, and TNF-alpha inhibitor. So cyclosporin is basically a calcineurin inhibitor. This cyclosporin and even tacrolimus, they both inhibit. Now calcineurin is basically required for the activation of NF-AT, that is nuclear factor of activated T cells, which in turn increases the interleukin-2 by T cells, right? So cyclosporin, tacrolimus, they reduce the activation of NF-AT, that is NF-AT का activation inhibit करते हैं by binding to the immunophilin. So cyclosporin binds to cyclophilin and tacrolimus binds to FKBP. So net result is inhibition of gene transcription of interleukin-2. So they are as immunosuppressants. They are used in organ transplant में यूज़ करते हैं. They are also used in graft versus host disease and autoimmune diseases like psoriasis and rheumatoid arthritis. So this is the detail about the cyclosporin. Next question is, which of the following is wrongly matched? Okay, so now this is a question on the anticoagulants. Here the options that are given are dabigatran, idarucizumab, rivaroxaban, andixanet, fondaparinux, and siraparentag, and apixaban is andixanet. Now in this, it is important that you remember them. ये आपको रटने वाले answers हैं. Now andixanet is an antidote. So I'll write here, andixanet is an antidote for factor 10A inhibitors. Okay, it is FDA approved for reversing the effect of factor 10 inhibitors, which are rivaroxaban and apixaban. So ये वाले तो दोनों options सही हैं, ठीक है. Idarucizumab is a monoclonal antibody against dabigatran, that is also approved, right? So this is also right. So now the option that we are left with is this, fondaparinux and siraparentag. Now this is the right answer here, as it is wrongly matched. Why wrongly matched? Because siraparentag is basically an investigational drug right now, and this is also for many other anticoagulants, including factor 10A inhibitors like rivaroxaban, apixaban, edoxaban. This is also effective against dabigatran. So dabigatran, then heparin, and fondaparinux. So this siraparentag is a drug which will be effective against this, but since it is an investigational drug and it is not approved right now, so the right answer of all the following options given here is this. Next, a patient had symptoms of redness and photophobia. On examination, cells were present in the anterior chamber with keratic precipitates. Intraocular pressure was 38. Which of the following anti-glaucoma drugs should be avoided? So out of all the drugs, now पहले यहाँ पे problem क्या है? यहाँ पे हो गया है anterior uveitis. Okay, so that means it is an inflammation, right? Now inflammation is there, so which drug will you avoid? PG analogs, beta blockers, mannitol, carbonic anhydrase inhibitors. Now out of all the options given here, PG analogs have to be avoided because they are mediators of inflammation. So you will not give this PG analogs. You can give beta blockers, mannitol, carbonic anhydrase inhibitors. They will reduce the glaucoma, but PG analogs have to be avoided. Next, a hypertensive patient has grade 4 renal failure and GFR is less than 30. So see, renal failure patient है and उसका GFR जो है less than 30 ml per minute. The physician wants to prescribe a thiazide diuretic. So which is the best drug? Now out of thiazides, hydrochlorothiazide, chlorthalidone, metolazone, and indapamide. Now thiazides are generally ineffective when the GFR falls below 30, but metolazone maintains the efficacy even when the GFR is less than 20 ml per minute. So 20 to 30 में भी effective रहता है, less than 30 में बाकी और other thiazides not effective, right? So here the answer is metolazone. So metolazone is the thiazide diuretic which is effective in this case. Next question is, a study is conducted to see the effect of different drugs on isolated mammalian intestinal tissue in tails organ path. Now which is the likely drug from the graph given below? You can see that initially the amplitude is good and slowly when the drug is given the amplitude is falling down. Is it acetylcholine? Is it BACL2? Is it adrenaline? Is it KCl? So now the tissue here is intestinal tissue. Intestine में acetylcholine causes stimulant effect. It will increase the amplitude. Barium chloride is a directly acting stimulant. So barium chloride भी stimulation करेगा. Adrenaline is a depressant. Adrenaline reduces the amplitude after instillation. So this graph looks most probably like adrenaline. So decreased amplitude after the drug is given. So the right answer is adrenaline. Inhaled NO is used for the treatment of inhaled NO. Inhaled nitric oxide is the first vasodilator to produce pulmonary vasodilatation, and it is used in the treatment of pulmonary hypertension. Out of migraine, labile hypertension, resistant epilepsy, and pulmonary hypertension, inhaled NO is used in pulmonary hypertension. Nivolumab is a monoclonal antibody used for the treatment of. Now nivolumab, as you know, it is a immune checkpoint inhibitor, right? We had studied it in the earlier lecture also, that it is an immune checkpoint inhibitor and it binds to PD-1 and then inhibits the T cell activation. So now which is the cancer it is used in? So this is basically used in treatment of, out of the given options, Hodgkin's lymphoma, medulloblastoma, retinoblastoma and pleuropulmonary blastoma, it is used in Hodgkin's lymphoma. Now I know it is very difficult to remember like this, and unless and until इनको रटोगे तभी इसमें कुछ marks मिल पाते हैं. A patient is taking chemotherapy, cyclophosphamide, methotrexate, 5-fluorouracil for treatment of breast cancer. She developed fever and on investigation she had anemia and neutropenia. Now which antimicrobial is not indicated in this case? So here understand that this patient is immunocompromised. So immunocompromised patient में we have to give cidal drugs to be used. Don't use static drugs, right? So piperacillin, tazobactam is cidal, cefepime is cidal, linezolid is static, and meropenem is cidal. So the answer here is linezolid, not to be used in this case. A patient on reticabine therapy for a month for focal seizures. Now phenytoin is added to the therapy. What is the next step? Reticabine already चल रहा है. Reticabine is a potassium channel opener, right? Now when a patient is having this and phenytoin is added, so phenytoin, as you know, it is a major culprit. Phenytoin आकर धमाल मचाता है, and ये क्या करता है? Phenytoin is basically inducer of metabolism. So ये reticabine का metabolism increase कर देगा, उससे उसकी efficacy कम हो जाएगी. So what you have to do is you have to increase the dose of reticabine. Which of the following drugs can be used for the treatment of severe COVID-19 pneumonia in children? Now this is a very tricky question. पूछ रहे हैं बच्चों में. आपका suddenly ध्यान जाएगा रेमडेसिविर पे. नहीं, रेमडेसिविर is contraindicated in children. What you have to give is steroids. So give steroids in children. We administer a drug following first order kinetics if the administered dose is doubled. Now first order kinetics may remember the half-life and clearance. They remain constant. Okay, and plasma concentration is directly proportional to rate of elimination, or उल्टा भी कर सकते हो, rate of elimination is directly proportional to plasma concentration. So if the administered dose is double, what will happen? The plasma concentration and elimination half-life remains same, plasma concentration becomes double, elimination half-life remains same, elimination half-life becomes double, plasma concentration remains same, elimination half-life, plasma concentration both remain same. So here this answer is wrong, this answer is wrong. Plasma concentration will not remain same, it will double. So the right answer is this one, that plasma concentration, when you double the dose, it becomes double, but elimination half-life remains same because in first order kinetics half-life and clearance remain constant. Okay. Which of the following is correctly matched regarding intrinsic resistance to antifungals? Intrinsic resistance मतलब उसकी उस पे एक्शन होनी ही नहीं है. So here the again there is a factual, Candida krusei and fluconazole. So Candida krusei is intrinsically resistant to fluconazole. It should be treated with either voriconazole or echinocandins. And preferred dose for Candida glabrata is echinocandins. Transition to oral fluconazole or voriconazole. Okay. For resistant cases you can use amphotericin. Topiramate is used in the treatment of. Now topiramate is actually an anti-epileptic. So this anti-epileptic, इसके mechanism of action बहुत सारे होते हैं. सोडियम चैनल का ब्लॉकेट करती है, पोटेशियम चैनल को ओपन करती है, increases GABA activity, reduces AMPA activity and weak carbonic anhydrase. So topiramate के अंदर ये सब actions है. So now it is particularly useful in GTCS, ठीक है, focal, even when they are refractory, and Lennox-Gastaut syndrome. So this drug is used in the treatment of Lennox-Gastaut syndrome. Apart from epilepsy, this drug is also effective in reducing the craving of alcohol, obesity, migraine prophylaxis, and bipolar disorder. Okay, so these are more uses of topiramate. What is not the off label use of risperidone? ये क्वेश्चन मुझे बहुत पसंद है क्योंकि ये बहुत शानदार क्वेश्चन है, बहुत कंफ्यूजिंग क्वेश्चन है. पूछा है what is not the off label use of risperidone? So post traumatic stress disorder, obsessive compulsive dementia and bipolar. Now risperidone is an antipsychotic, right? Antipsychotic है, and it is FDA approved for the treatment of psychosis, right? Psychosis, schizophrenia हो गए, bipolar disorder, attention spectrum disorders, attention deficit disorders. So it is actually FDA approved. So not the off label नहीं है. बाइपोलर डिसऑर्डर इज ऑन लेबल यूज़ है. PTSD में इसका यूज़ नहीं है, OCD में नहीं देते हैं, डिमेंशिया वगैरह इन सब में देते भी हैं तो ऑफ लेबल देते हैं, इनका FDA अप्रूव यूज़ नहीं है. ठीक है, सो इसलिए ऑन लेबल यूज़ इसका बाइपोलर डिसऑर्डर है. सो द आंसर हियर इज बाइपोलर. Which of the following is FDA approved drug for long term treatment of obesity? Long term treatment of obesity में the drug which is approved is out of this ibutramine, liraglutide, metformin, fenfluramine. So liraglutide is the drug. This is basically incretin mimetic drug, है ना. GLP-1 and GIP एनालॉग्स होते हैं. इसी के जैसी आती है दूसरी सेमाग्लूटाइड जो बड़ी फेमस है आजकल. ठीक है, सो दीज आर द ड्रग्स विच आर यूज्ड फॉर द लॉन्ग टर्म ट्रीटमेंट ऑफ ओबेसिटी. A newly diagnosed tuberculosis patient found to be HIV positive. Which of the following statement is true? So now here the patient has TB plus HIV. Okay. Start ATT and ART together. ART started only when CD4 count less than 50. ATT started first followed by ART 2 weeks later. ART started first followed by ATT 2 weeks later. So patients with active TB usually they also have advanced HIV disease, or you can say that HIV when it reaches in advanced stages usually presents with TB. So here the first thing that you should start with ATT should be started first followed by ART 2 weeks later if the patient has not started ART. Then so पहले आप TB का फर्स्ट करोगे, देन HIV की दवाई पहले बाद में दोगे. इससे क्या होता है कि ट्यूबरक्लोसिस की दवाई स्टार्ट हो जाती है, पेशेंट गेट सेटल डाउन, देन इंट्रैक्शंस आर अवॉइडेड, राइट, इंट्रैक्शंस अवॉइडेड, कंप्लायंस बेटर. एंड ART शुरू करने पे कई बार होता है IRIS, दैट इज इम्यून रिकॉन्स्टिट्यूशन इन्फ्लेमेटरी सिंड्रोम, सो दैट इज अवॉइडेड. इफ यू स्टार्ट ATT फर्स्ट एंड देन ART, दिस इज अवॉइडेड. A patient with stroke is started on clopidogrel. Now he developed another episode of stroke 6 months later. Which is the likely cause? So clopidogrel start करिए. Clopidogrel के start करने के बाद patient had another episode. So what is the likely cause? This is also one of my favorite questions. And why favorite? Because immediately what you will think that clopidogrel जो है rapidly metabolize हुई और इसीलिए इसका effect नहीं आया. So what you will do is you will go to the option 1, right? You will go to the option, yeah, whatever, 1. लेकिन ऐसा नहीं है. पहली चीज, first in clopidogrel कौन से CYP से होता है? CYP 2C19 इससे होता है, ये याद रखना है. सेकेंड थिंग इज क्लोपिडोग्रेल, सबसे इंपॉर्टेंट चीज जो है, इट इज़ अ प्रो ड्रग, ओके, एंड इट इज़ एक्टिवेटेड बाय दिस एंजाइम. तो अगर क्लोपिडोग्रेल इससे एक्टिवेट ही नहीं होगी तो फिर ये जो एक्टिव मेटाबोलाइट नहीं बनाएगी, एंड एक्टिव मेटाबोलाइट नहीं बनाएगी तो फिर इसका एक्शन कम हो जाएगा. सो हियर एक्चुअली द आंसर इज पुअर मेटाबॉलिज्म बाय CYP 2C19, मतलब क्लोपिडोग्रेल उससे पुअरली मेटाबोलाइज है, एंड एज अ रिजल्ट इट इज नॉट टेकिंग सफिशिएंट एक्शन. नेक्स्ट क्वेश्चन, विच ऑफ द फॉलोइंग इज ट्रू अबाउट निकोटीन रिप्लेसमेंट थेरेपी? निकोटीन रिप्लेसमेंट का पहले भी हम कर चुके हैं. सो वेरेनिक्लाइन इज अ फॉर्म ऑफ निकोटीन रिप्लेसमेंट थेरेपी दैट कम्स विद ब्लैक बॉक्स वार्निंग ऑफ कार्डियोवास्कुलर एडवर्स इफेक्ट. द क्वेश्चन हियर इज व्हाट इज ट्रू? सो वी नो दैट वेरेनिक्लाइन does not cause cardiovascular effects. In fact, it causes CNS effects. There should be a gap of minimum 15 minutes between nicotine and coffee or acidic food. Yes, this is true because there should be a gap, otherwise absorption of nicotine is affected. NRT is given by GI route. NRT, no, we give NRT सबलिंगुअल देते हैं, हम इन स्प्रेज देते हैं, हम गम देते हैं, और हम पैच देते हैं, और हम लॉजेंजेस देते हैं, बट हम ऐसे खाने को दवाई ओरली नहीं देते हैं. निकोटिन गम इज बेटर बिकॉज इट अटेन्स 10 to 15% हायर प्लाज्मा कॉन्सेंट्रेशन देन लॉजेंजेस. नो, लॉजेंजेस हैव अ हायर प्लाज्मा कॉन्सेंट्रेशन दैन गम बिकॉज लॉजेंजेस पूरा का पूरा एब्जॉर्ब होते हैं, उनके अंदर का निकोटिन पूरा एब्जॉर्ब हो जाता है. लाइक गम में फिर भी थोड़ा बहुत बचा रहता है. A patient is given ipratropium and he developed paradoxical bronchoconstriction, right? Now ipratropium देने के बाद paradoxical bronchoconstriction हुआ, which is not a likely mechanism. Not a likely mechanism. Now here, what is not a likely mechanism? Ipratropium is an anticholinergic drug, right? तो ये basically muscarinic receptors को inhibit करेगी. Okay, let's see. Benzalkonium chloride, presynaptic stimulation, use of hypertonic saline, and EDTA. So now likely mechanism is benzalkonium chloride. This can be impurities that are present in the inhaler. EDTA, this is again an impurity. Hypertonic saline and nebulizer can be a reason of bronchoconstriction, but presynaptic stimulation नहीं, presynaptic होता है inhibition हमेशा. So presynaptic inhibition of M2 receptors and increased release of acetylcholine can be a reason. So the correct answer here is this, because they are asking not a mechanism, right? Mechanism of action of local anesthetics. ये बहुत ही simple question है. Local anesthetics का क्या mechanism है? They alter the RMP of the cell. They decrease the transport of potassium across cell. They decrease the transport of sodium via voltage gated channels. They bind to receptor complex and prevent activation of KX. So they basically reduce the transport of sodium via voltage gated channels because they block the sodium channels, and that is how local anesthetics act. For treatment of which of the following conditions a combination of antimicrobials is not required? Combination of antimicrobials is not required. For what? Malaria, gonorrhea, intra-abdominal infection, tuberculosis. See, tuberculosis we use ATD, that is a combination. Intra-abdominal infection में we use gram positive, gram negative, and anaerobes. इन सब का हम combination लेते हैं. Malaria में we use a combination. Gonorrhea is one single drug which is ceftriaxone is used in gonorrhea. So gonorrhea is the disease where we don't use a multi-drug combination. Which of the following antihypertensive is avoided in patients with high serum uric acid level? High serum uric acid level में कौन सा antihypertensive नहीं देंगे? We know the answer very well, hydrochlorothiazide, because they increase the uric acid. So if you'll use in this patient, it will further increase. Enalapril, prazosil, atenolol, they do not have any effect on, do not affect the uric acid, right? So in this patient, uric acid level वाले patient में हम hydrochlorothiazide नहीं देंगे.